Wonderful job till now, and thank you. All these people who are standing here, including Rumi, all Nilima, Hemant, Manish, I know Dr. Mayank, everybody needs to be complimented and there should be a standing ovation for whatever they have done till now. So we all need to give them more courage. It's not an easy job, let me tell you.
Thank you for
In spite of the fact that only 198 people have come forward, Rumi is standing here and still giving you all the courage. That in itself is such a courageous moment for us. So you all need to support us, and we will definitely take your dreams forward also. Don't be afraid. That is a very good thing which Dr. Rumi has said.
Thank you. अभी आपका thanks मतलब 2 line after your lecture. गाना तो सुपर था.
मर गए.
Friends, let us all formally thank the council members in their designated capacity. Okay, they are here in other capacity as well. But let us thank our registrar, Mr. Navle. Navleji, thank you very much for coming here, giving your valuable time. And the council members, Dr. Rumi, Dr. Heman and Vidyaji. Please give them thanks for all their efforts. And let us go ahead, and before we go ahead, as Dr. Raman has also mentioned, that ASP has been working tirelessly since so many years. Okay, we all appreciate the fact, and we want you to take a message to all your friends that please don't listen to rumors. There are people who are spreading wrong rumors. Okay? We are here to help you. You are seeing the quality of education that we are giving you. The best environment, the best ambience, the best teachers, all here. Dr. Raman has flown down from Delhi to give you some education. Let us start by giving him thanks in advance. Okay? And now let us go ahead with our scheduled agenda. Dr. Raman needs no introduction. He is one of the most senior acupuncture practitioners of our country. I think 40 years?
37.
37, we are same. Even I have completed 37 years. So we are like colleagues in years also. And he has worked in many ways. Research-based work, clinical-based work, even when it comes to the recognition of acupuncture. I remember in 2008 we were part of the National Coordination Committee. Even that time 20 of us got together and we are seeing the whole fruits now. So Dr. Raman Kapoor is now 60 years old. थोड़ा young बना रहे हैं आपको. Okay. He has passed his MBBS from Delhi, and he went to Switzerland and Sri Lanka, where he achieved clinical experience in acupuncture. He has started practicing acupuncture in 1982, and because of the excellent results, he continued practice. He is currently the chairperson of the Department of Acupuncture at Sir Gangaram Hospital, which he started 21 years back. Okay. So, Sir Gangaram Hospital has an acupuncture department since 21 years, and very soon we will see that happening in Maharashtra as well.
I want that. That's very important.
Yes. And not only that, but you will also get good career opportunities and a good job opportunity in this vocation. And The feather on the cap was he is recipient of the Padma Shri Award, awarded by the Honorable President of India, Srimati Pratibha Patil in 2008. And I'm also happy to announce that very soon Dr. Rumi also will be in line.
Yes, definitely.
Padma Shri Award. And one by
He's already got a Padma Vibhushan in my eyes.
Right. So, I think this is a very, very big profile. I have to cut it short, sorry, because otherwise the topic will be missed out. So I hand over the mic, and he is going to present a very new and interesting subject called peripheral nerve stimulation technique, which I believe you have picked up recently, right?
Yeah.
Okay, so the latest technology for your benefit, Dr. Raman, please.
Thank you, Dr. Mahan. Today I am going to introduce to all of you a very interesting technique which is linked to acupuncture, and it was developed by a neurosurgeon in Japan. So this is a Japanese style of acupuncture. I met this gentleman in April in Vancouver, Canada, where I had gone to attend a conference on acupuncture, and I was quite surprised that his mental thought process was very interesting. He said that I entered into acupuncture because I was not very happy with my own profession of neurosurgery. I had done many surgeries, and I had realized that even simple conditions like Parkinson's were not getting better. So he realized it over a period of time that why am I into this field, and then suddenly he had a back problem himself for which he was taking Western medicine, didn't get better, took acupuncture from one of his colleague friends, got better. So he decided to learn classical acupuncture. He learned it, and then he said he was very frustrated. And I think that happens to a lot of us also, at some stage in our profession, because he said there were so many schools. So either I followed modular school, I followed the Chinese school, or I followed that school, or Tung school, or Dan school. So it was too much of confusion. And finally he said, I thought that this is too much, and I was not getting any clarity into my work. Because a patient comes to you basically to get better. He or she is not concerned whether you are using a Tung system or a Tan system, or the classical Chinese system, or the ear acupuncture, or anything for that matter. His concern is he should get better. So he said, I realized this, and I thought I should go back to my basic sciences. And the basic sciences was that he realized that most of these techniques of acupuncture were nerve root based. So they were basically on nerve pathways. So he opened up his old books and he realized that everything was dermatome connected. So all of you know what are dermatomes. Dermatomes are nerve pathways, and we have over 35 dermatomes, and these dermatomes are linked to the entire spine also, and there are some other dermatomes also which I will talk to you about, which he realized as he has done this work. Over about 15 years he has been doing this work. And I met him there. I did a workshop with him in Vancouver. The workshop was just about 5 hours, but I picked up that system there. And I started practicing it right as I came back today. And from April to about November, I was working on that, and I started getting good results. The important is your patients are getting better. And let me tell you, the good part about it is, for all of you sitting here, is there is no needle penetration in this method. So a lot of you can start right away. So when I saw this gentleman doing it there, I was initially quite surprised as to why that this system is working so well, and why is it that I would not like to learn more about it. So me and my wife, Dr. Sunita, we decided that we should go back to this gentleman. He is now about 84 years of age, and he doesn't teach people individually. At best, he has got many students of his. They do these courses for him now. He doesn't teach himself. So I had written a few emails to him, and most of these Japanese, they don't know English also. There's a major issue with a lot of these people. So he put me on to somebody else who was working for him, and she used to reply back to me saying that the professor, his name is Professor Nagata, Nagata. So he says Professor Nagata doesn't do any individual courses. So I said, no, it's a request, that two of us would like to come and work at his clinic and see him working, and if he can do a workshop for us, a learning proper, because I would like to see more patients being worked by him on only this technique. He doesn't use anything. He doesn't use any needle whatsoever. So the needle which he uses, I will show you that also. So he finally agreed. That was my good luck. So there were 2 Americans who also had shown keenness and 2 of us. So 4 of us only. And into his private clinic, he would attend in the morning hours about 30 patients every day. And let me tell you, he would not spend more than 5 to 7 minutes on a patient. That's about all. And in 7 minutes the patient would be out. And the next patient would be in. And then we will be given a slip in English about the history of the patient, how long he has been coming to him, and what symptoms he had before, and what is the symptom as of today, and he will give the treatment, and then the questions would be left to after the lunch session, because post lunch we would have our presentations in that clinic itself. So for 4 people, good enough space to have a presentation. So it's a very one-to-one interaction and one-to-one learning I did, which was amazing. And that is what I decided right then, because Nagata told me, Raman, yours is a country which would be very benefited with this system which I have founded. Because you have a huge population and there are many medical problems there, and this is something which can be done even at the grassroots level. When I tell you the simplicity, you will be actually surprised, that it is so simple, how can it be a science? But it is so simple but yet so effective. That is why I thought the first place which I am sharing this knowledge today is Mumbai. And I plan to do such seminars all over the country to create an awareness about a system which is as simple as what he has explained to us, taught to us. There would be some things which would be something like, people say, this is a very basic thing, because in an hour's time you can't do everything, but then people, once they start practicing it, then they can obviously come back to us and we can also share our experiences. But I think what I would like to teach you in this 1 hour should be sufficient for you to take away, as Dr. Baramji says, the takeaway thing should be what should be taught in such seminars. 15 minutes, 20 minutes, half an hour of presentation doesn't give you that much of takeaway. Like for example, a patient, one of us comes and says, okay, I've done 4 patients of this condition, 10 conditions of Bell's palsy. They are good papers. I'm not saying I'm against that. But then the takeaway things should be the ones which should be focused in these types of 2 days, 3 days conferences. So that people who go back from here have learned something new and have started using that in their practice and giving it back to society. That should be the aim of such conferences. I think Dr. Rumi will agree with me on that. That should be the aim we should be carrying forward. Next slide, please. So I am first of all thanking Dr. Nagata, the originator. So PNST is a therapy which he named it, a peripheral nerve stimulation technique. So I learned this therapy in Japan and he encouraged me to promote this in India. He is very keen to come to India, but since he is quite aged, I told him that I will plan in such a way that when we have a big conference, maybe in New Delhi, maybe when the Central Council comes up, we would like to invite him also to come over and definitely. But I think what I feel is that a lot of people here are already good teachers. I can see a lot of you sitting here. And if they can pick up the basics from me, they can start teaching it themselves. And I feel that is the way to go. Next please. So what is PNST? PNST is what is known as Prickling Neurostimulation Technique. It is a very simple but effective treatment method. It applies a quick prickling stimulation to the surface of the skin with a pointed tool. And depending on the patient's complaints, the area of the stimulation is determined according to the affected dermatomes. And what is a dermatome? A dermatome is an area of the skin which is supplied by a single spinal or a cranial nerve. Next please. So the body has 30 dermatomes. This includes one on the face also. And a dermatome chart is a schematic map which shows the area which each dermatome covers and the location of its specific nerve root. And this is mostly used for diagnostic purposes. So for example, I'll give you an example. Suppose you have a numbness in your thumb and the location of the disorder is where? It is at C6, because the sixth cervical nerve controls the thumb. So if you have a model of a human body with dermatomes, actually if you go back home today and open your web internet and just see a dermatome chapter and take a printout of it and keep it on your table, you will have everything in front of you. It is as simple as that. A dermatome chart is what is required by you. This gives you all the information that which dermatome supplies where. So suppose there is a nerve which is getting impinged from there, and that is what is causing your numbness in the thumb. So if you treat or do prickling, I'll exactly say the word, it is not picking, it is prickling, which means just irritate that nerve root at the C6 and also do some local prickling around the area, immediately you can see the results. I will, if anybody is ready, I will even show a demonstration of that for all of you. Next please. So this is the dermatome chart I am talking to you about. If you see, you can see the anterior and the posterior presentations. So you can see each of the dermatome starting from C2 downwards, C8, then T1 to T12, L1 to L5, S1 to S4, and you all know by your anatomical knowledge that like for example on the sole of the foot, where is which dermatome is supplying. So patient has got numbness on the sole of the foot, you know now which area to be prickled. So that would be the L4, L5 area which needs to be prickled. In addition to doing prickling at that area. So sometimes, when I was going through this learning process, I was also thinking that probably the distal acupuncture which we learn about, tongue and tan, could be somewhere also explained by this technique. But this looks to be more scientific to me and more easier to do than going through the yin and the yangs and the kidney excess and the liver deficiency. It sometimes, and this is what Nagata told me, it was getting too confusing for him. Going through the pulse, going through the tongue, and finally not landing up with results. So what the patient has come to you is for results. So he started feeling that the results for most of the conditions could be seen very quickly with this method. So you can do a treatment and look for the results right there. Maybe 2 sessions, maybe 3, but nothing beyond that. Within 2 to 3 treatments only, the patient should start coming back to you saying that I'm feeling better. And most of the time, we have even seen it right there itself. Even a condition like numbness, a diabetic neuropathy, I have seen just getting better, not getting cured, but in 1 session. So that is something which was very amazing to me. I know patients coming to me with disc prolapse, with acute numbness, wherein normally, we are not very sure whether this patient responds or not. The pain part can be taken care of, but numbness sometimes takes a long time. But in those patients also, with disc prolapse, I have found with this technique, the results are very good. Next please. So now these are the acupuncture points on the back, which we have normally been using for years together. We have the Vato-GIG line, we have the UB line, we have the lateral UB line, we have the SI channel going there, the LI, the triple warmer, all that is known to us, the gallbladder. Next please. So as indicated in the figure, the acupuncture points on the back are located on the spine as well as on both sides of the spine at regular intervals. So the back acupuncture point chart and the dermatome chart seem to be overlapping. He also realized this. So immediately Nagata studied the distribution of the acupuncture points from the viewpoint of the dermatomes and confirmed that the major acupuncture points were in fact lined up along the nerve pathway in a dermatome. Next please. So he developed this PNST chart which integrated the dermatome chart and the acupuncture chart with additional points which were needed to cover all the dermatomes, and he named this approach as the dermatome theory. Next please. So now this is the PNST chart. If you see, exactly what he has done is this central line, which is the line of the spine, he named it as the 0 line. So the mark in the spinal 0 points is indicated by 0. So what he would say is that there is a 0 point along the entire spine. It's very simple. So there will be a 0 point at between C2, C3, C3, C4, C4, C5, and so on and so forth. So this is what he called as the 0 line. So when you do prickling, he would say do prickling along the 0 line. Alright? So there would be a 0 line of prickling, there would be a line next to that, which would be the Vato-GIG line, there will be a UB line, and there will be a lateral UB line also. So these are the areas for prickling. So for example, for the neck problems, you will do prickling at the zero line from C3 to C7 as well as the Huerta-Giardi line. You can see that. So shoulder problems, upper back from C8 to T6, T7 almost. Then for the mid back from T7 to T11. From T11 downwards to L4 is the lower back. And from L4 down to the S4, you're covering up the sacrum area. So depending upon the area of your problem, you can do prickling at that particular zone. And when he started this prickling method, what he was using was just a toothpick. So it could be as simple. So go back home today, start doing it on your friends and family. You can be surprised at the changes. You can be actually surprised. Although now what he's developed is a tool, which I'll also be showing to you, which I use in my practice. But initially, you can even start with a toothpick. Nothing else. The first tool he said he used in his lifetime 15 years ago was a toothpick. Then he refined it to a forceps, because the forceps also has got that, you have to have a sharp point. It actually gives you the effect of a needle, let me tell you. And I'll show you doing it to somebody. It gives you a feeling as if you are being needled, but the process is so quick that the patient is very easily able to accept it. Because so many times a lot of people are apprehensive with the word needle. So here you say you're not putting a needle, because you're not retaining anything. Just prickle and then that's it. The treatment is over. And the patient can see the results. So it's very interesting. And it was a challenge to me to accept it initially in April when I started off. But when I did a few patients, and then my interest became so much that I wanted to go back to him to learn. Next please. So how is the treatment performed? So when a patient comes to you, I first find out obviously his or her condition. Then I identify the dermatome where the sympathetic harm exists. What is sympathetic harm? Sympathetic harm is the term which is named for the area of the disorders or diseases which are caused due to the stressed sympathetic nerves. You all of know. There are two systems, the sympathetic nervous system and the parasympathetic nervous system. So stress is what is taken up by our sympathetic system. And if it is Parkinson's disease, for example, the disease area we know is at the substantia nigra of the midbrain. And when the autonomic nervous system is diseased, the sympathetic harm is in the brainstem. So there are two areas, the sympathetic and the parasympathetic harm. Then when the targeted dermatome is determined, then I stimulate the corresponding points in the dermatome along that nerve pathway. And if necessary, I also stimulate some additional points. So the PNST treatment, the fingers, face and head. So this is a basic treatment, which would mean any patient who would come to me who has got a chronic problem. So remember, you have to identify between an acute problem and a chronic problem. So most of the patients who would land up with me normally would be, most of you also will experience, are chronic patients who are suffering for a long period of time. So these patients you require to do a basic treatment. I'll show it here in front of you, a basic treatment protocol, so that you understand what is a basic treatment protocol. So that basic treatment consists of 3 steps. We start at the jingle points. Very simple for us. All of you know all this, so it's nothing very big. So jingle points, then we prickle at the points of the face and the head. So in my clinic, I prickle the jingle points on the root of the fingernails, and this encourages the autonomic nervous system to shift towards a healthier balance. So how he explained scientifically was that we are shifting the autonomic nervous system towards a healthier balance by prickling these points. Remember, not pricking, prickling. These are the jingle points, you all know them very well. Next I apply to the patient's face. So this is the degerence chart, which again you can see on the net, very simple. The skin of the face is controlled by the trigeminal nucleus at the brainstem, where the autonomic nervous system is located. All of us have read this in our basic sciences when we were going through our medicine curriculum. Now a stimulus on the facial skin is directly transmitted to the brainstem and then to the midbrain and the brain. And thus it can influence the autonomic nervous system and the hormones. And the autonomic nervous system controls the body temperature, the appetite, the libido, the sleep, the immunity, everything. And the vagus nerve from the brainstem regulates internal organs like heart, lungs, stomach, intestines, liver and pancreas. Thus, the face is the area where we can stimulate the autonomic nervous system. So when you do a basic treatment protocol of the face, which I'll tell you the points where he will be doing it, you are actually treating the entire autonomic nervous system. Then I treat the head with PNST, and stimulating the head leads to what? It leads to a parasympathetic response in the brain, and it activates the diencephalic pituitary system. And the basis of this presumption is the improvement which is observed in patients whose diseases are dependent on steroids. So any patient who's coming to me, like a chronic asthma patient, patients whose autoimmune disease, I get a lot of Sjogren's syndrome coming to me. Those patients, when I tried this treatment, I was actually amazed to see the change, because these patients were dependent on steroids, and they were actually able to gradually taper off the steroids, because we had started releasing the endogenous steroids with this prickling. It's so simple. Then with PNSD on the head, I have been treating diseases which are dependent on steroids like rheumatism, collagen diseases, bronchial asthma, hay fevers, atopics, ulcerative colitis. So these basic PNSD treatments are often enough to induce the desirable parasympathetic responses. And depending on the other symptoms, you also prickle the relevant parts on the back and the peripheral nerve pathways as needed. So now the treatment part. So back and the peripheral nerves. So dermatomes on the back of the body are divided into 6 parts. I often start treating patients at the spinal nerve root level, as I showed you on the chart. For example, a patient comes to me for knee pain. So where is the sympathetic arm? It lies in the dermatome from L3 to S2. Very simple. All of you know all this. That where is the supply? The supply to the knee joint is coming from L3 to S2. So that is the dermatome which is supplying the knee. So what I'll do, I will make the patient, and this is what he would do. He would normally make a patient sit on a chair, just push up the clothes. Very simple. On a chair, he doesn't even require a bed. He will only do the bed treatment when he has to make the patient lie down on the bed. Otherwise, he will just make them sit on a chair for a knee problem and just push the clothes up and just prickle from L3 to S2 in the 0 line, in the Vato-GIG line, and the UB line. Alright? Thereafter he will go to the knee and just do prickling around the knee. I'll show you the circular pattern he does it. And that's it. The treatment is done. So I start prickling the 0 point in the spinal nerve root in the dermatome, and I see the effect of the treatment. So you can ask the patient about the pain right there after you've prickled the spine point. Just ask him or her to walk, and then you suddenly find that the patient is getting a bit of improvement. And then you do the local prickling around the knee joint. So I always apply treatment along the nerve pathways which control the knee. So in a knee joint treatment, I will not only prickle locally around the knee, I will do the most important prickling around the back spine. Now this is the brachial plexus area for a thoracic outlet syndrome. We get a lot of such patients. So this is the area where he will do the prickling. I'll just go back to show you the, So the points which we are touching with that probe, which I am going to show to you, are the stomach 12, stomach 13, lung 2 and heart 1. So these are the 4 points which, because he also realized that most of his students would be acupuncture practitioners. So although he was prickling an area, but that area he identified with the acupuncture points also. And that helps practitioners like us who are already practicing acupuncture to be able to do it at the acupuncture points itself. And that's how it helped me, because I was able to identify which exact point he was prickling when he was doing that treatment. So the points for this thoracic outlet syndrome which he was doing was stomach 12, 13, lung 2 and heart 1. Then for pain on the side of the neck, the sternocleidomastoid muscle. We all know this is a very important muscle and a lot of us get spasm here. So he will just prickle at SI16. That was the important point on the muscle, on the posterior border of the muscle. Then the axillary nerve point for shoulder pains, SI9, 10, 11, 12, triple Warner 13, 14 and LI16. Again only prickling, no needling at all. And after the prickling, if the patient, suppose a patient cannot come regularly for treatments, then what he would do? He would just put zero size serine Pionex needles. I have never seen the zero size. They are not available with the company also. This company only makes it for Dr. Nagata in Japan. So it's not available also. I tried. It's a zero size. I'll show you the Pionex needles. Like the ear needles we have. This is the zero size Pionex needles. So after he has finished the treatment, he would put these zero size needles at these points and leave it and the patient can go. He can retain it for 10 days, 15 days, no problem at all. It's very comfortable. Then the radial nerve point for pain, paralysis and numbness along the radial nerve pathway. So you could be presented with any of these symptoms around the radial nerve pathway, which we see every day in our practice. So this is the pathway we all know, and this is the exact pathway area. So this is the radial nerve point which he would be using, and it will treat the entire pathway. Then the musculocutaneous nerve point, which we used to use for the pain, paralysis and numbness along this pathway, which will be all along that particular nerve route only. You can see the area supplied by that musculocutaneous nerve. So everything is dermatome explained. Then the medial antebrachial cutaneous nerve, this point you can see that area where he will do the prickling. This is the area. This is the exact area. And this is exactly the nerve root pathway. You can exactly see on that picture. Then the musculocutaneous nerve point for pain, paralysis and numbness along the pathway as I was talking to you earlier. This is the particular zone. And this is the zone I am showing on the other figure, which is the area from where patient will come to us complaining about. He could be having pain here, he could be having after a stroke, he could be having paralysis or numbness in this particular, or there is a muscle power has come down in this area. Then this is the radial nerve point for a wrist drop. You can see that. So this is the area, about 6 to 8 centimeters in length. This is the entire area, we all know that. The zone supplied by the radial nerve. So you will prickle along the entire zone. Then this is the median nerve point. This I use for carpal tunnel syndrome. As a matter of fact, you will be surprised. I am sharing my own experience. Left hand of mine had an acute carpal tunnel syndrome. And this was in April, May when I had gone to Vancouver. First time. And I tried acupuncture. My wife is always there to help me out, and she's very happy when she needles me. All wives are very happy when they needles their husbands, so she is looking forward to the opportunity. So I took about 10 sessions. I didn't feel much change. The problem which I used to feel was acute pain, and specifically less than the pain was a numbness, which would come to me in the middle of the night. And in spite of the best effort of mine to not be able to keep my hand in a particular position, at night when you're sleeping you don't know, and it used to get pressed. And my nerve conduction clearly showed moderate median nerve compression. So, since acupuncture was not helping me, when I went to Japan, I just asked this professor in the workshop, can you do something for me for my hand? He said, just sit down there. And he did this prickling. Next day was this conference was for about 3 days, but his workshop was finished. So next day when I met this gentleman there, I told him I felt something better because I could sleep better that night. Every night I would get up with numbness, every night. She says, yes, now you know it works. I said, but you are not going to be there. So he said, I've explained to you, so you start. So I bought that first PNST probe, which this is his probe I am showing to you. This is absolutely, this is the thing which he uses, nothing else. And this is designed by him, it is made of titanium. So he said, buy one probe, he explained to Sunita how to do it. And every day is so simple. You don't have to be at home or in a clinic, wherever we used to be, even during our trip, she will easily do it. It's that simple. And I did it for about a month, and since then I have never had this problem come back. That is the personal experience which made me run back to him, especially to learn more on this technique. Just PNST. So this is the pathway. So obviously the treatment would be very simple. Everywhere that you feel the numbness or tingling coming, you can do this quickly. Everywhere means you don't have to be identifying points or acupuncture points. You can do it wherever the patient is complaining to you. And most important, at the cervical dermatomes, because that is the root. Unless you treat the cervical dermatome, the zero line, the water jelly, the UV line, nothing will happen. So you do the treatment there, you do the treatment here, and look for the changes. And additionally, you can put those zero size needles, and she used to put it on my hand. It's very simple. Zero size needle, you don't even feel the prick. That's a good part. It is something like a Pionex sealing needles of the ear, which you still feel the prickle. But zero size needles, there is no feeling at all. It's a very fine needle, I'll show you also. Then the ulnar nerve point for pain, paralysis and numbness along that pathway. Then the femoral nerve point for the hip muscle spasm. So you can see that entire pathway, we all know that. So whenever the femoral nerve will get irritated, where all the symptoms will be. And this is the area, the inguinal area. So you have to do prickling here. So for symptoms along this area, you have to do prickling here. So you have to, that part you have to be very sure about. And this is very simple. Anybody who has read his basic anatomy knows it, that if you are having symptoms here and the femoral nerve is the one which is affected, where is the femoral nerve? So you have to prickle the femoral nerve. You can prickle the area locally also, but main area of prickling should be the femoral nerve and the dermatome at the back. Very simple. Lateral femoral cutaneous nerve pain for point for the pain and numbness along this pathway. So you can again see that particular area, the gallbladder channel which we talk about, and where you need to prickle. So he's shown that with the red spots. You can see that is the area of prickling, and that is the area of the symptoms. Then the saphenous nerve point for pain, paralysis, numbness along the medial side of the thigh and knee and the calf. And a lot of patients, he will tell me, and this is I found, and he called it as saphenous neuropathy. So a lot of patients who come to us with knee pain actually have a saphenous neuropathy. They don't have a knee arthritis. So many times we'll go on treating the knee and we'll say the patient is not improving. Actually, if you just prickle the saphenous nerve along this pathway and treat the L3 to S2 segment dermatomes at the back and put a few of these crest needles, zero needles, that's it. The patient will start showing improvement. The common peroneal nerve point for pain, numbness and foot drop. The superficial peroneal nerve point for pain, paralysis and numbness along this pathway. And I think the best results which I saw in his practice were for neuropathies, which is a very dark area or grey area in acupuncture. So deep peroneal nerve point for pain, paralysis and numbness along this pathway. Posterior tibial nerve point for pain, paralysis and numbness along the pathway. This is the kidney channel we always use there. And the area where the symptoms are, I've shown in that one. This is the area. So for this area, pain and numbness, you will be doing prickling along this area. Alright? All this will be with you because we have already shared the entire presentation. And obviously you can see it at your leisure also. The sural nerve point. So this is the UV channel as we always have been doing. So you do prickling here and you will feel improvement here. The patient will present symptom in this area and this is the area to be prickled.
Can we take up questions now?
No, I will have to just show you also. So I'll try and be as fast. The superior cluneal nerve point for pain, paralysis and numbness along the pathway. This is the superior cluneal nerve. This is the middle cluneal nerve. This is the area where mostly a lot of patients will have spasm. The piriformis muscle syndrome as we talk about, and we do a lot of deep needling and that needling. You don't have to do anything, just prickle. The patient will get up and give thanks to you. It's so quick. Yes. And you put a few embedding needles there. This is what I do every day now. I think I've changed over 70% of my practice into this. The thoracolumbar fascia point for lumbar pains. The piriformis muscle point, as I was telling you. And the confirmation of the effects. Whether or not the PNST treatment actually induced the parasympathetic response has to be evaluated from the immediate responses as well as the long-term effect. The immediate response that the patient often experiences includes a sensation of warmth, slight sweating, salivation, lacrimation, sleepiness and bowel movement. And when the parasympathetic nervous system becomes dominant, the blood circulation improves. And thus the patient often experiences immediate pain reduction and improvement in the range of motion. And for long-term improvement, I evaluate the patient's symptom and also rely on certain parameters like the white blood cell counts. And we can also determine an individual's stress level by the ratio of granulocytes to lymphocytes. This is very interesting, which he told me there. There's a meter. So the NLR stress meter, he called it. So if you do a simple blood test, you can find out the neutrophil to the lymphocyte ratio, and this reflects the amount of physiological stress. So normal ratio should be 1 to 3, 6 to 9 is mild stress, 9 to 8 is moderate, and greater than 18 is severe stress. Beautiful. Now I'll just do a demo of the PNST on Jingwell points, the scalp, face, nose and the mouth and the eye, and I'll just show that first in 2 minutes. It's so quick. I'll ask Manish. Manish, can you come here please? Can you please put the lights on? And put the, focus the screen onto this place. And just put a chair here please. No, he scalp is there is no screen. You are the center of attraction.
Yes, yes.
Please come here. So he is complaining of numbness in the greater toe on the right side. That's all. Both toes. Both nowhere else. Nowhere else. All right. And screen में नहीं है. The cameraman is not come today. I'm really sorry.
आँखों देखा हाल.
You will have to all see from there.
आँखों देखा हाल.
ऊपर कर दे. नहीं ऊपर इसके ऊपर नहीं है. Yes, टूट जाएगा.
गिर गया तो बाद में देख लीजिए.
No problem. So he is totally complaint of
Silence, please. I am explaining the process. Silence, please be seated.
great toe on both the feet is numbness. And are you diabetic? Since how long? 28 years. So we have a history. So as a doctor, you should always look into the history of the patient. So one of the important factors which could be coming to my mind would be a diabetic neuropathy. So that diabetic neuropathy could have been causing this symptom. And now, is this located only on the dorsal surface or also on the plantar? Only on the plantar, not on the dorsal. मैडम पीछे आ जाओ, किसान बड़े सारे पीछे आ जाओ, कोई बात नहीं, क्या करें देखो.
Everybody please sit down in your seats.
Oh, he is recording it.
Sit down in your seats, everybody.
Okay, there
Otherwise the
is
session will
numbness.
cease.
Silence, we are wasting
It is
time.
being recorded. Please sit down. You will get it on YouTube.
You will get it, don't worry. देखो ऐसा है, अभी इसके बाद लंच टाइम भी होगा. अगर आप कोई चाहोगे तो हम वहाँ पर लंच में भी किसी को ऊपर दिखाएंगे. मैं यहीं पे होगी, जब तक मैं हूँ मैं दिखाता रहूँ.
Thank you.
Very soon you will get the videos on YouTube, which will be sent to you by Mr. Vinayak Paranspil.
Yes. So I just ask you to please keep listening. So now, नीचे रखना सर. So now what I am going to do is a basic PNST treatment first. So all chronic patients must do a basic PNST, and after that the specific area to be treated. All right. So for example, in his case, because he is a diabetic, he has been having it for so many years. There is obviously a parasympathetic response which needs to be taken care of, and the autonomic nervous system needs to be regulated. So what we do is a very simple protocol which is followed. So this is a cover, basically nothing else. I just remove the cover. This is the PNST needle. It's a titanium thing, nothing else. There's nothing very big about it. We can actually get it manufactured in India also. I'm looking at options because this is a very expensive device I got from there. But actually, since it was the beginning and I wanted to do work on it, so anyone of you who wants it, I can import it for you from Japan initially. But subsequent to that, obviously, you can think of making it's nothing else than titanium, that's all. And Nagata's name is written on it. He just writes H. Nagata. But very simple man. I've yet to meet such simple people in the world. Very simple and straightforward. And he was glad he shared that knowledge with me. Alright. So, what I do is, I look at that center point, which all of you know is DU20. So, between the DU20 and the anterior hairline, he just puts the two fingers there, the thumb and the index finger, and he will prickle. So prickling is done simple, five points between these two. 1, 2, 3, 4, 5. We have finished. So prickling 1. Then the second zone is between the ear apex and this area. He takes another line. So about midway. So midway from here to here. 1, 2, 3, 4, 5. 5 points. Again on the opposite side, he will go here. 1, 2, 3, 4, 5. So 15 points in all. Thereafter, from DU20, he will go back to the external occipital protuberance, put both the fingers like this, and between these two, he will prickle 3 times. 1, 2, 3. That's his protocol. So we are following that. And we have seen results, that's good enough. So 15 and 3, 18 points. Thereafter, we come to the one side, and we can take any side. So this side I am taking up. So from the ear apex to the external occipital protuberance, we have put 2 fingers, and between these two, the midpoint is the first point, 1. Between the mid and the back, the second. Between the mid and the upper one, the 4th. So this is 1, 2, 3, and then he takes up 2 points more. The one just above the ear apex, which is almost gallbladder 8, and one behind that, 1 chun. That's it. That completes this line. Then he takes up another line, which is at the back of the ear, mid back, and the DU16. This is another line he makes, and in this also he will take up 1, 2, 3, and the 4th point is at the mastoid, gallbladder 12. So these are the 4 points. That's the prickling here. I'll repeat it on the other side. The same thing. So top from here to that point. So 1, 2, 3, 4 and 5. And then from the midpoint here to the DU16 and 1, 2, 3, and the 4th point is the mastoid.
So this you are doing because it's a chronic case.
Yes.
In a chronic case, this is a
Must do the basic PNST. Alright? So having covered the scalp now, we will now come to the eye area. Very simple again. The first point is right at the diaphragm area. 1, 2, triple 123, 3 and 4. You can say UIO and this gallbladder, and then yes, and then UB2. That's it. And the opposite side, 1, 2, 3, 4, 5. So quick. I do
this is also general.
Yes, this is general. This protocol is general. Then come to the midline and below the eye, 1, 2, 3, 1, 2, 3. So 10 points here, 13, 3, 16, and then 2 more points, which would be at this area almost, yes, 18 points for the eye.
So could you show the sir that side?
No, it's okay. You'll get the video.
We will do it again and again. No worries. The time is limited. Professor wants me to leave. So then I come to the nose points. So nose points are 1, 2, 3, 4, 5, 6, and 7. I'm not talking about the sinus. This is a general protocol you can give to all your patients. This is the basic PNST. And thereafter we come to the face points, the lip points he says it, and these are 1, 2, 3, 4, 5, 6, 7, and the angle of the mandible 8, 9, 10 and 11. And that finishes the basic protocol. This has to be done on all patients who are chronic patients. Now I come to the, we will reply, let me first finish the protocol. Now you can stand up, please. Now the area where he is complaining of the problem. Now we all know the supply line to that area is L4, 5, S1 and S2. Alright? So what I am doing is very simple. I am just marking his L4 point here. We all know there, and I am just trying to see the UB32 because this is one point you would use very often, which would be at the posterior superior radial spine. Alright? So what he would do is he will locate those points and then prickle in the zero line. So zero line prickling, very simple. Please move around. This is the zero line. So just prickle. 1, 2, 3, 4. Finished. Next, what is here? 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Finished. You can please sit down. And the next question is, I will ask, is this numbness the same?
No, it has slightly reduced.
Good.
Yes.
Can I have a chair, please? Now
But I can see much better now.
Before I forget,
Really?
before I forget, I missed something, so I will cover up that also in the basic, the jingle points. So we'll just quickly go through the jingles. All right. 1, 2, 3, 4, 5, and 6. 1, 2, 3, 4, 5, and 6. So we finish the jingles of the hand.
So this is a general
Jingle protocol. Again, part of the basic PNST. As I said, I missed the basic PNST. The jingles only was left. Rest all we cover. Here also, jingle very simple. 1, 2, 3, 4, 5, and 6. 1, 2, 3, 4, 5, and 6. Alright? Having done this and having done the basic protocol, now I will be going to the specific area where you will be complaining of, which was the area of the toe. Alright? So what we are going to do is do prickling here.
So this is random.
This is not random, this is exactly in the area of his problem.
No, but in that area.
So what he would do is, I will explain that also to you. So many times he will just do this basic thing at that area and then he will ask the patient, are you feeling better?
Slightly better, yes.
And then next thing what he would do would be, which is even more important than this, is you can go in a, like circling the dragon. So what you would do is just take this as a center point and go around. You can go a bit down also. And you can do on the other side. You can do it anyway, not a problem. Yes, prickling. That's it.
My eyesight has improved immediately.
Great.
Really, I can see much better now.
So, as he says to me, and this is what I have learned from the master, himself, he says there will be a lot of problems in our autonomic nervous system. So the regulation of the ANS itself can be great benefit to the patient. So, and this is very simple, you can actually do it yourself also. He actually teaches a lot of his patients and their family who come, because back may take difficult to do that, so back wala prickling the patient. And you can start with the toothpick, I am telling you. I am serious about it. You can start with the toothpick.
A big applause for Dr. Raman Kapoor. Please interact during lunchtime because we have to move on.
Prickling is not necessary clockwise, anti-clockwise.
So what I have done is I have brought a model also for this. So what you do is you take 5 toothpicks together and put them in the rubber band. and that gives you the same effect.
Just close to
As a So 5 of them, he says use 5 of them and just put a rubber band so that they are tight enough, and then you can do prickling.
Thank you.
Thank you.
Thank you. Very wonderful.
Rush through it quickly. Next, please. Remember that. So patient will actually tell you, sir, यहाँ पर बहुत तकलीफ हुई. But when you go on doing it 2-3 times, the patient himself says, अब कम हो रहा है चुभन मेरे को. So that is an indicator that the body response reaction is taken over. Particularly, I have found this very useful. No questions now, sir. Later on. Particularly, I have found it very useful in patients with stress, and I get a lot of them. Delhi is full of people with stress everywhere now. Anxiety syndromes, insomnia. Just do the basic PNST protocol. Just do that, nothing else. You'll find a lot of people even feeling drowsy or very relaxed there. It's so quick to effect. And then this is the prickling treatment for bruises. So I have tried it on some sports people and they have shown an immediate response. So it's a spiral fashion, the bruise is there and you are doing a prickling all around. You can see that. And you can even use for Achilles tendonitis. Walk and see where you still have pain, and wherever the pain is left, you can prickle the remaining painful area again and do it twice a day. In patients who have acute pain, you can do it twice a day. Keep the area warm, and calves belong to the S1 and S2 of the dermatomes, so you know that, very important. Just keep that for a few days on your working table, the dermatome chart, and after that you don't need it. It's so simple. You will by that time know it, that the areas, and so accordingly you can do it. So prickle the first and second sacral foramina as well for this patient, and then for ankle pain, area of the ankle, and prickling for the pain at the right ankle, you stimulate the painful part in a spiral pattern, and medial malleolus belongs to L4 and S2 syndromes, dermatomes, so you can prickle the corresponding lumbar and sacral point on the back. Simple. And tenosynovitis, pain in the tendon, so you are doing prickling in the area, evenly on the area of pain. Osteoarthritis, I already told you, the area belongs to L3, L4, L5 dermatomes, so you prickle the lumbar and sacral areas also. Then for numbness, treating numbness is more difficult than treating pain, and prickling treatment needs to be done along the entire nerve pathway, so it is important to know where the pathway runs in the body. Like prickling, just have a look. So prickling for sole numbness, the heel is there, so the sole belongs to L4, L5, S1 and S2. That's what I did for you. So you can prickle the lumbar and sacral parts of the back as well, and you can prickle in that zone also. And carpal tunnel syndrome, I have told you that. Then prickling where you do it.
Can you summarize?
Yeah, classic migraine. You can do it. Occipital neuralgia. You can do it at the back. Then cervical discs, the 0 points for shoulder neck stiffness. So shoulder stiffness, sternocleidomastoid. SI16 I told you. Low back pain where you can do the prickling, the painful area. And for allergies you can also, now this is the good part which I wanted to share with you. For asthma and atopic dermatitis, in addition to the scalp, face, eye, nose and mouth points, you can also the prickling area for allergy and asthma are kidney 23, 24, 25, 26 and lung. So this is what he is additionally telling. This is the advantage I had of going to Japan. Otherwise, when he did that basic workshop, he didn't talk about these things. Now for asthma attacks, you can prickle the LI4 point. Another point which was effective was CV22. Then for difficult conditions, I have told you already, for constipation also, you can prickle around the belly button. Then heat therapy. Now this is very important, I wanted to share with you. He says after you finish the prickling, you must do heat therapy to that area. So you can apply a hot shower. This is very good way. And then hair dryer also. You can put a hair dryer on that area. Suppose you have got groin pain. After you do the prickling, just use a hair dryer to that area. Then foot bath therapy. He says this is excellent, and about 42 degrees warm water. You put your foot for 30 to 40 minutes, and very good for rheumatoid and catching of a cold, feeling chills. And a hot shower on kidney too. Now this is something Hiroshi Watanabe, he's a surgeon again in Japan, who studied acupuncture, and he taught about the effect of kidney too. And he says when you stimulate this point, it relieves discomfort in the throat in almost 100% cases. So what I do now is, patients coming to me with change of weather and complaining of sore throat, I just prickle kidney 2 and put a small press needle there, 0 needle, and we leave them. And we are surprised at the results. This is what I want to share with all of you. This is something which is a revelation to me.
We need a full day's workshop,
Yes.
Dr. Kapoor.
Steam towel.
Summarize now.
There, thank you there. I don't need to summarize because you, Mayank is holding a sword around my neck, so I better not go any further.
That's my job here.
Thank you. Thank you.
I
so much.
hope all of you enjoyed this.
Thank you very much.
Thank you very much.
We could have given you a longer time today, but next time definitely.
It's a
No questions at the moment, please.
No questions now because the next speaker is ready. So what we will do is in the lunch hour we are most welcome. I will carry that in my pocket and I will show you. And actually I wanted to show that press needles also, but I can show you in the lunch hour. Very
Yes,
simple.
sir.
You can just place it.
Thank you. I'll call Mr. Narayan, our registrar over here to present the token to Mr. Raman Kapoor, Dr. Raman Kapoor.
A token of appreciation. Thank you, Dr. Raman, for this beautiful experience. Okay, please forward to us. We got a link of a news channel which has.
I think if you have 5 minutes, we can display it here. After, okay.
We'll forward it.
Sure.
The news is already spreading, and I request all of you to spread the news. This 175 to 200 participants should reach out to 20,000 people.
Yes.
Please raise your hand.
It is in TV9. It is on TV9.
Let's work towards a bright future of acupuncture. Now moving ahead. Now please pay attention. This morning session